We strive to provide excellent care. Quality is number one because we see that patient in that bed not just as a patient, but that patient is somebody's mother, somebody's father, somebody's husband, and somebody's wife. And we want to provide not only the best care, but the best evidence-based care here at Cape Fear Valley.
One of the strengths of this hospital is that you get world-class cardiology and cardiovascular care, but in a small town setting.
We go out of our way to keep up to date on the latest literature, to keep up to date on the latest techniques, procedures, medicines, the things that allow people to do better. There have been a lot of changes since I first got here, and we like to bring everything new that's helpful to a patient right here to Fayetteville. And I really truly believe that patients here can get the same kind of care that you would get at any other major institution in the country.
We are affiliated with the Cleveland Clinic, which is #1 for heart surgery in the entire United States. Our surgeons and our nursing staff, we often collaborate with Cleveland at least once a month. We will go visit their facility to learn new practices, new routines, to learn what's new out there, and we bring that same #1 care right back here to Fayetteville to offer to our community.
There's a big governing body out there that rates heart centers across the country. And the highest rating you can get is a 3-star rating. We have that rating here.
Only 14% of the hospitals in the country get a 3-star ratings, and Cape Fear Valley Cardio, Heart, and Vascular Center is right up there in the 14%.
We've worked in hospitals in New York and Boston, and I can tell you that the care that the patients get here is superior to any of those places that we've been before, and our results speak for themselves.
We've been recognized for this. Over the years we have had accreditation by organizations such as the Society for Chest Pain Centers for our care in dealing with patients with chest pain and heart attack, and more recently a recognition by the Joint Commission for our disease-specific care of acute myocardial infarction, which means heart attack.
It's nice to be recognized for what you do, but what's also important about being part of that process is that it makes sure that we're constantly looking at ourselves and improving ourselves. Every week we meet and review every QMI that comes in. So we're constantly reviewing actually every minute from their call to getting them to the lab and open them up. And what this does is we're constantly changing the bar of how quickly we open up the arteries. Patients will come up, they'll be really, really sick, and you get them open really quick, and within a half hour after they were incredibly ill, they're like, okay, doc, when can I go home? And it's almost like, do you know what happened?
We've seen a lot of changes over the past 15 years. The program now is a seasoned, growing program. We have a great team, and it's actually a great, dedicated, experienced team that's been together for quite a while now.
When my patient comes in, I want them to have a good experience because it's a holistic experience. When they get better, it's not just what the physician does, it's the whole team effort. So I think it's a wonderful team, and I think everybody in the community, they should really feel blessed and happy that they have this heart center here.
Most patients who come to the heart center are very satisfied, very happy with what they find. They even are blown away by the level of service and care to get.
I come from an academic institution where we've done a lot of kind of high-risk cases, a lot of cardiac interventions, and I'm just so impressed with the cardiologists here, the cardiology, the heart surgeons, the team approach that we do. I would send my own family member here without any reservation.
I have patients sometimes ask me, well, what do you really think of the hospital? There's the perception that maybe there isn't the good quality here that they would get up the road at one of the university settings, but I don't think that's true. If I did, I don't think I would work here. I don't think I would stay here. And one of the highest compliments I can pay to the facility and to the surgeons and to my partners is that if I myself was having heart disease, I would have no reservations about coming here for my care. If my wife was having heart disease, I would have no reservations about bringing her here. If she needed a surgery, if I needed a surgery, I would be more than happy to have Dr. Maughan operate on me or anyone in my family.